Okay, here we go. Welcome to the webinar, everybody. We're so glad you're here. So we're going to talk about how to feel less stuck and to feel like you have more choices and more joy in your busy work as a woman doc. So thank you very much for sharing your time with me. I'm sharing 9 things that I wish I knew way earlier as a woman doc, and how those things would have just really changed the landscape, how I navigated, how often I was laying in a hammock. So thank you, and let's go. So busy women docs, is it like? Well, I just want to say that there's nothing wrong. There's nothing that you did. Today's the day we're just going to learn together. We're just going to learn about long-lasting solutions. I see you. I see you on the wards. I see you in the clinic. I'm not in surgery, so I don't see you in surgery. But retired, it's a lot of work. It's really busy. And I just want to share these 9 solutions with you. And why? Because it's for you. It's for people who want to help others, who want to feel creative, who want to, have people actually acknowledge all that they've accomplished. They want to keep growing. I love when I'm doing something new and learning something new. I don't love every minute of it when it's uncomfortable and new and fresh. It's uncomfortable, but it's really good for us to kind of push and get into that uncomfortable zone so we can keep growing, keep our career, interesting and long lasting. So we're going to talk about, who wants some guidance on how to take those next steps, where to find that interesting spot to make your current career journey a little bit more exciting. What to do when you feel scared? Do you stop, or how do you, keep going when it actually does feel scary? And we know that's the neuroscience of, we just haven't built those pathways yet. So we're going to do that together, is learn about these 9 areas that we can really know about and use, not as a destination, but as a long-lasting tool that we can use over the years. And we all want to feel impactful. We want to feel like this matters, right? I was just doing this coaching exercise. I'm learning how to be a business coach for women docs. And I'm in a 6-month program, and I'm in my 2nd month. So I have an accountability partner. We coach each other, and we were doing this exercise called the 5 whys. So if you haven't done this, feel free to put it in the chat. You've done it, you haven't done it. The 5 whys. If you have no idea what I'm talking about, it's really interesting. So we were talking about why we were doing something, why we're taking this step. And you keep saying why. And I did it once with, like, why do you exercise? Why do you take care of yourself? Like, because it's good for you, because it'll help you feel better. And by the end, I was like, I want to be around as long as possible for my kids. Like, ooh. So sometimes, to feel impactful or to feel something really meaningful, you have to ask yourself 5 times why. So here's what we're going to learn tonight and today, and those that are listening on the replay. Here's what we're going to learn. Well, I love to be able to use these tools to make sense of the current challenges of medicine. There's some really long-lasting challenges of medicine, and there's some new challenges of medicine. But let's also get some insights into the culture of medicine. I never found that anywhere. I just had to kind of figure it out and navigate and ask a lot of questions, but I never saw anyone really explain to me the culture of medicine. And of course, it's different. There's some nuances in different institutions and even different teams. They say there's a microculture. But we're going to jump into, how do you find those insights and figure out the culture of different areas of medicine? Well, I love to talk about brain wonder, and reciprocity is, how do we give the brain something so that we can keep, working in our strengths and hopefully doing great things in a very high risk profession. That's something else I don't hear often enough, is medicine is a high risk profession for burnout. Burnout can lead to mental health disorder, diseases. So we want to make sure that we start with brain wonder. What does the brain need? And this reciprocity we're going to talk about is, we can't just demand of the brain. We actually need to give it some things and support it. And the other thing we have to know, and I don't think we talk about enough, is that our colleagues have a high risk of emotional distress right now. And emotional distress is contagious. So if we're in a room, and the literature suggests 38% of our colleagues are in severe emotional distress right now. That's from the Mayo Wellbeing Index. If you want some details about that, just DM me or email me. at thebrainfresh@gmail.com, and I'm glad to send that to you. Because Mayo does a global survey and queries all kind of healthcare workers, and that's where that 38% comes from. So when we're in a room, that's a lot of people in that room are in emotional distress, and that was severe emotional distress. So, and that's contagious. So we as humans kind of share emotions and bounce emotions off of each other. So just know that being in that environment can really increase the risk of us also having emotional distress or more negative emotions. We're going to talk about this clear neuroscience framework that I've built and sketched out. And it's really helped me personally. I've been a neuroimmunologist for 30 years, and it's helped my clients. I have a company called Brain Fresh, and I help my clients navigate a career in medicine. And it's been neat to see them use this framework to make sense of how to take those next steps. Actually, it's been really neat to see folks just, kind of light up, because when we're informed and we have insight into tools that will be really helpful, we feel really positive, right? And positive emotions is what we really need to take those steps forward. And the world needs us, right? The world needs us all living in our true strength. So we want everyone to really be feeling like fulfilled, like they're able to really work at their highest level of abilities, use their gifts in this world. And that's really what we're after. And what I didn't hear in medicine, but I found to be really helpful, is to learn from other professions. How do they navigate a long, fulfilling career journey? So I went out and worked with women in business and other businesses, and brought it back here to medicine, because I think there's things that we can, other people have already figured it out, so we can use some of those tools. And there are solutions to help us find purpose and meaning professionally. And it's frustrating not to feel those things, to feel like, does it matter? Is all of this worth it? I went to a heck of a lot of school. What do we think about that? Well, let's talk about culture. How do we even figure out culture? Well, this is from a model. It's called Shine's 3 Levels of Organizational Culture. And of course, it's the iceberg. And we're used to in medicine talking about the tips of the iceberg. So where do we start? We talk about behaviors, artifacts, and behaviors. So when we're trying to figure out the culture of medicine, there's things that we see. We know doctors tend to wear lab coats. Well, now, the trainee docs, they wear a lot of scrubs. They don't even wear lab coats. They wear their fleece jackets. Some ICU docs wear their fleece jackets, not always lab coats anymore. I'm kind of old school, so I still wear my lab coat if I'm in the hospital and in my clinic. But there's things that we can see very clearly that we know we're in a medical setting, right? So we can tell by what's on the desk, what's in the drawers, how a person greets you, the questions they ask us. So there's things that are very obvious about a medical culture. And then one level below, little C, below sea level are the norms and values. So what are the norms in medicine? Well, of course, in medicine, one of the most important things are no errors, right? We want to take care of the patients, keep the patients safe. We always say patients first, always patients first, patient safety, help the patients first, right? That is a norm for us. What that norm does, though, for professional development, sometimes we think the same way, like, let's not make any errors in our professional development. We have to be careful. We have to be really sure that we have it all mapped out, just like we would with the protocol that we're going to use with patients. And that's one thing about the medical culture that we don't have to take to our personal or professional development. We can try new things. We don't have to follow those norms of medicine in our professional development. So this is where knowing the culture of medicine and the messages that we receive regularly in medicine, we don't have to take them all when we're thinking about how we're going to develop ourselves professionally. And our values. What are our personal deep values? This is something we do in Brain Fresh regularly. We'll talk about that in a minute. But we want to know what's really important to us. A lot of times the institution will have a list or on the website or something of their values. And sometimes we know those off the top of our head. Sometimes we have to think, like, what are our employer's values? But generally, you can find that pretty quickly, what your employer shares as the top values of the company. And that is part of the culture of medicine. And then there's one more level. And those are the assumptions and beliefs in medicine. It's the lowest level because they're very hard to figure out. I have some assumptions. Like, I thought if I worked at X place for so long, I would have access to professional development, that every year I would have access to places to learn. But I realized over the years, I have to go find my own places to grow. Like I've done that through the American Academy of Neurology. I've done that with the clinic at WPSA. That's our Women's Professional Staff Association. That's given me a lot of opportunity to grow, meet new people, build new skills. So there are times that work provides opportunities to grow, but there's also times that we have to watch our assumptions in the culture. Sometimes I would assume that everything would be even, that all the patients would get the same care, that the gender of the patients wouldn't matter, or the race of the patients wouldn't matter, the gender of the doctor or the nurse wouldn't matter. But now we know, we've seen through this, what we just talked about, the burnout data, that there are assumptions and there are inequities. And some of those are coming to light. Maybe they're coming a little bit higher up on the iceberg, but we have to learn and think about the assumptions and beliefs. And that's what's really tricky about figuring out the culture, is knowing what's down deep. Another way I like to think of culture is, what are we floating in? Like if we're these beautiful flowers, these lily pad flowers, these lotus flowers, what are we floating in? Culture is like that to me. Like what's in that water? There's nutrients in the water, in our culture in medicine, there's things that we've learned about. There's history of how things have always been done. So there's dead things in there, there's living things in there, there's dirt in there, there's nutrients. So that pond or that water that those lily pads are growing in is full of a lot of things. And that's how the culture is, and especially the deepest level of culture. So it's a little hard to figure out. So I could start in my own area. I'm a neurologist. What is it like for women in neurology? This is from a study that was published in the Journal of Women's Health. It's from 2019. So it was right before COVID. And they surveyed 798 neurologists. These were women neurologists. And they had a pretty good response rate. And what they found is 35% were kind of neutral or dissatisfied with their current situation. 42% had symptoms of burnout. That's a high rate. And unfortunately, neurology is right now, at least in those Mayo, that set of data from Mayo, neurology was the highest rate. And there's some, theories of why that is. So it's unfortunately higher than that, than this data from 2019. And one of the things that was listed is hard to find time to do all the documentation that's needed. Other concerns with the environment is high stress. They didn't have, they felt like a lack of control over their work schedules. They worked a lot of hours, and they reported some gender discrimination in their experience. But other literature and other studies show that women docs do, wonderful things. They have interesting practice patterns that leads to higher quality outcome for the patients. And this is, also published. This was a study from 2005 in a journal called Diabetes Care. And women docs, did more preventative care. They did more of the cancer prevention services. They did more psychosocial counseling for the patients. They had better outcomes. And this is an older study, but there's newer studies that again suggest women docs, we do really good work. So does it sound like you, a woman in medicine? If you want to put anything in the chat, I can't see the chat right now, but maybe some of my folks can tell me if there's any chats coming in. But do you recall, that overwhelming joy when you got into medical school and you were and now you go to work thinking like, oh, how am I going to get through this day? It's going to be a busy day. I started today at 7 a.m., clinic starts today for me. And I'm just thinking, okay, let's go. I want to help these people. I want to be there for them. But it's a busy day, and so that's what a lot of us go to work like, okay, how are we going to pace ourselves? How are we going to make it through the day? Are you looking around for opportunities where you work and you see inequities in the opportunities? Did you hope for more in medicine? Do you feel stuck? Do you wish there were more opportunities? Do you wish someone would bring it to you, like a cool idea of how you could find some excitement and some growth at work and have that feeling again, like when you got into med school, that excitement, that like the sky's the limit, that there could be a new day, some new opportunities for you? Are you sick of those annual reviews where they say the same thing to you and do not offer you any growth opportunities? Do you wish someone understood your day-to-day struggles, what you go through at work, and just acknowledge them? People are going through hard things, and as we see a lot of patients with a lot of challenges, and it's, another thing to learn is medicine is a high-risk profession because of the level of emotional interaction with the patients, is what the literature suggests. And there are neuroscience-based tools that we can use, and I make them understandable and simple because I like to just share things and do it at a very simple level so we can all jump in and use them right away. And these tools can help you navigate a high-risk profession. I like to call them and keep it simple and call it brain priming, aligning, and designing. So we learn how to prime our brain for a busy day. We learn how to align with all our gifts and our strengths, and we learn how to design a really impactful career. Anyone want to put in the chat what you thought the first year that burnout was even reported? Anyone have a guess? Feel free to put it in the chat. How was I? I was 7. That's your hint. So the reality of burnout, it has been around a long time. It was reported in 1974. So it's not new. And if we're all waiting here today for it to go away, I would say it's been around a long time. It's been around for 50 years. And so waiting for the system to change, I understand. I also work in the system. I work with American Academy of Neurology on their advocacy committee. I work with the National MS Society to support patients. I try to help the system of medicine, and I do work on it. And there's a lot of national groups working on it. But unfortunately, there are still a high risk of, like we said, the emotional distress and burnout. This is from an AAMC study in 2021, showing that there are healthcare institutions that have named people well-being champions. But unfortunately, those well-being champions are not given time, training, or funding to do the job. So here you're asking someone to help their colleagues, help their team, help their department. But a lot of the well-being champions were reporting on this survey from AAMC that they didn't have the funding or training to even help their colleagues. So that's not quite fair to put someone in a position, not give them any resources or funding. So what's the problem? I mean, if you ask me, I think we should have a brain class. We should all know brain 101, just a little bit of how the brain, and knowing a little bit about it, having a little bit of brain wonder, can really help the busy growing professional. And what we don't hear a lot about is that our emotional level is like a gatekeeper to our ideas and our creativity levels. And we don't always learn how to connect our neuroscience power until there's a problem. So when I see if colleagues are burned out, or I hear about colleagues burned out, they're taken out of work, they're given counseling, maybe coaching. And of course, people are working on the system of medicine, but that one person has to then go learn new tools to hopefully survive or thrive in medicine. So I really haven't learned, but I'm going to share with you now, like how we can brain prime when we work in a high risk profession. So sometimes people ask me, what are the other high risk professions? That would be like teacher, other healthcare workers. It's what the literature suggests is that ongoing high emotional interactions, whether it be extreme joy, fear, sadness. So in medicine, we share a lot of emotions with the patients, and that seems to be at least part of the challenge. Okay, the good news is professional well-being tools can be taught. So we can put some fortifying tools in place, and so that we can put them in place before we're being pulled out of work and being treated for burnout. There are people after your attention. So believe it or not, people get jobs to try to grab our attention, to grab our focus, to grab our energy. That's on social media. There's a lot of businesses trying to grab our attention. But once we know that and how the brain likes to follow those cues that the people put out there, we can put a wall down so we have better focus and we can save our energy for things that are important to us, to give our attention to things that are really important to us. I think a culture in medicine is like another language, or if you go to a new country, once you understand it, it makes so much sense. But when you get to a new country, you look around and you're trying to figure out what is the norm there. Once you understand the culture of medicine, then you realize how to navigate it, just like going to a new area, a new country, even sometimes in the US, a new state. There's little things that are different. And so you can figure that out. Once you know how to navigate, you have so much more fun, right? And culture has many layers, and the deepest one is not very apparent to us. It's harder to figure out. Emotions, the level of emotions and our emotional state matters in our learning, our perceptions, our connecting with others. So not knowing our emotional setting really will then maybe decrease our ability to learn, perceive, to connect with others, to feel creative. And we can share what the other professionals have learned because they've learned some great tools on how to navigate professional careers. And we haven't really employed all those in medicine yet. And we can borrow some of those and learn from the best. And the important thing is to build power in your own eyes, make you feel like you have power to design your career pathway. But we also can teach you how to build power in others' eyes and what's important to others. Of course, that also, kind of leans back to culture. If you don't feel like you belong on your team, in your department, you will not be able to work at your full level. The brain just cannot get to its full level of creativity, productivity. So that's an important thing to know. And we'll talk about that in the 9 steps. Do you know what are your core values? Have you ever done an assessment, like taken a sheet, have a list of values and figured out what is important to you? It's really important to do that. We do that within Brain Hammock, well, I'll tell you about. And it's important to know your strengths. We also do that in Brain Hammock so that you come away like, hey, this is what's important to me. These are my line in the sands. This is what I'm really good at. This is going to help you navigate your career journey. Do you know that work helps us feel important and useful in this world? So I treat multiple sclerosis. So I have a lot of patients, unfortunately, need to leave the workforce and they feel like they're not useful anymore. And they have to kind of reinvent, how can they be useful now as they live with MS? The amazing thing is we have like MS medications that work so much better. So I see my patients having so many more opportunities, staying in the workforce, having more job opportunities. That's really amazing. But work can also have a positive or negative consequence on the brain. So if we live in a high stress environment, we don't feel like we belong in our work team, we don't feel like we're valued, that will be negative brain consequences, negative neurochemicals. So we need to kind of figure out the lay of the land and what's important so we learn how to focus, get our work done, feel like we matter, and see if we indeed in the culture, if we are valued. I love to know and to share a few steps to give the brain some more support so that you can, keep learning and keep your career journey interesting. So once you adapt and learn these 9 steps that I will teach you, you feel less stuck because you feel empowered. You feel like you have insight, less confused, less disorganized, less like, I don't know what to do. I don't know the next step. Because I love to keep things clear and I love strategy and I love to just share a 9-step framework. And you keep using this framework at different levels of your career planning. It's so wonderful to have clarity. Why waste our time on things that don't matter? Once we know the core actions we should take, that is the key. Okay. Here's what we can imagine the results will be after we can use these 9 steps. You can feel empowered. You feel informed. You feel enthusiastic. You feel brave because you have this new, toolkit, holding you up, and you feel courageous. Courageous doesn't mean you have all the answers. Courageous is just that you're willing to take that next step. So who am I? I'm Dr. Mary Rensel. These are some pictures of my family, friends, business. I really love sharing neuroscience strategies and making them really understandable and simple. I'm still working as a neuroimmunologist. I'm boarded in neurology and integrative medicine. I serve on national committees and state committees, and I also serve on a state board of Ohio National MS Society. I have served and worked with adult and pediatric MS patients over the years. I'm really interested in innovative ways of serving patients in holistic ways and using strategic initiatives to really support those who are doing amazing things in the field of medicine. And I'm the owner of a company called Brain Fresh and the co-owner of another company called Brain Ops Group. In Brain Ops Group, I work with Allie Hively, and she and I partnered and we created a professional well-being system for residents and for nurses. So reach out if you have questions about those. And of course, I'm a mom of 4, and my baby's going to college this fall. So please reach out with any tips you have how to handle that. Okay, who's ready? So we are like this beautiful flower floating in that pond. Did you get the handouts? If not, I can share the handouts with you. I'm gonna stop sharing for a minute. Let me see. Okay, so you can use, if you don't have the handout, what we're gonna do now is use the whiteboard. If you don't have the handout, just grab a piece of paper and a pen. We're gonna start with the whiteboard. Please forgive my handwriting. Okay, so let's start. So go ahead and get your handout, or if you don't have it, just go ahead and copy what I'm drawing here. So we're going to start with 3 circles. 1, 2. So go ahead, you can make these 2. Nothing's perfect. We're not after perfect, just 3 circles. Okay. So what we're here, let me move this one circle. Well, we are going to look at this area here, color in the center. What this is going to lead to is feeling empowered. Okay, so excuse my writing. Forward. Okay. So what we're going to do is, this is the P. So on your handout, you can write prime, or on your paper. This is for align, and this is for design. Notice it spells pad, like our lily pad that we talked about. Okay, let's go back. Okay, so when we're talking about prime, start here. There we go. It's hard to write on the whiteboard. Okay, so just hang in there, give it a little dot the I. Okay, what we're going to do, and this is called the Genius Framework, kind of like a Zen diagram here. We're going to show the 3 parts of brain prime. Okay, so we want you to feel leaving empowered. So how do we, what can we do to brain prime throughout the day? Number 1, we have to make sure our calendar has fun in it. So let us put this down a little bit. F-U-N. Oh my gosh, it's hilarious. Okay, and then the second one we'll call cyber security. So we want to make sure, like, who's taking our attention. Like, it's like protecting your melon, you know? So how do you protect your melon throughout a busy work day? Who's stealing your attention? And we'll go over that. Then the next one here will be fine tune. So how do we fine tune our neuro state throughout the day to really build our attention and our focus, so we can get our work done and get home and have some fun, right? So this is fine tune. All right, fine tune. Can you guys read any of this? All right, there we go. Okay, and that's for prime. And then we're talking about design. I'm going to move this. Well, you know what? We'll get to that in a minute. Let's go to this. We'll go to align so we can see it better. Okay. So the 3 things that we need for our, out of our 9. So the important things to feel empowered with when you are working in medicine is make sure you're scheduling fun, because fun is a great brain state. Fun, it's generally with someone else. So you're physically with someone else, and it's a non-judgmental state. So if you're ever having fun, you'll realize, like, you're not judging yourself, you're not judging someone else. So neurologically, it's a great state for the brain, and you're also getting that double bonus of connecting with someone. So fun is really important to get your brain in a great state to feel empowered. Cyber is protecting your melon. So we talk about it, the brain, some people call it the melon. Why does that matter? So it is an organ and it needs support throughout the day. And you know, in Brain Hammock, we talk a lot about 3 ways that we can give our brain support throughout the day. And then fine tuning throughout the day. We can take 5-10 minutes throughout the day to reset our neurologic state. So most of the day at work, we're focused, right? And we want to get our job done. We want to get the tasks done. We're focused on the problem at hand. But if we take this time to step away a couple times, the literature suggests 3 times a day for at least 5 to 10 minutes, and reset your neurologic state, your focus will be better. Creativity will be better. This is what the literature suggests. And I'm glad to share the literature. In Brain Hammock, we go over all the research and the science behind these steps. Okay, so these are the first 3 steps with Brain Prime. Schedule fun. See, a lot of this is good news. Cyber, we walk you through that, and then how to fine tune your neurologic state. So for aligning, we want to talk about values. So what is really important to you, and use these as guardrails. So we talk about, so hard to write. We talk about using your values to gain guardrails, and it definitely helps you be able to say yes or no to people. And then here we talk about strengthening your gifts. What are your gifts? Well, in neurology, we call it the connectome, like how your brain is wired. It makes you really good at something. And sometimes it makes it really easy for you to do, you're really good at art. You're really good at putting the team together. You're really good at coming up with creative ideas. So everybody has their own gifts according to their brain pattern. We call that the connectome. So we talk about strengthening your gifts. And then here we talk about the importance of belonging, because the brain cannot get to its highest level of creativity, thinking, productivity, if within your team where you are, you don't feel like you belong. So that is super important to know, that how to assess if you have a high state of belonging in your team. Okay, so that's what we do throughout Brain Hammock, which I will share with you in a bit. So the D. So the D is design. How to design an interesting career path. I got you guys. So funny. Okay. So how do we design an interesting career path? One is a growth team. So we want to make sure we have at least 5 people that we hang out with that are actually honest with us and give us good feedback. Okay. The second one is to know the power of anger and advocacy. So what am I referring to there? So let's say, I think a really great story that illustrates this is with Mothers Against Drunk Driving. So the story is the woman, her daughter, the woman started Mothers Against Drunk Driving, had a daughter that was, I think, killed or definitely hurt very badly in an accident. And she went to court, and she saw that the gentleman who either killed or really hurt her daughter was not going to get much jail time, like many consequences for what he did. And so she thought, this is not right. So she got active in government and the local government, and she learned like who's making the laws. And so she took her, just intense anger and sadness over what the horrible thing happened to her family. And she became an advocate then to try to change the next generation. So if we feel like what we're doing is helping the next generation, we all want to be a part of that, right? Like we don't want to waste our time. We want to feel impactful. So I hadn't heard that before, that we could use what really anchors us throughout the day to think about maybe like an advocacy list. Like, oh, I wish this was easier for my patients. I wish that this was here for my patients. I wish we had this resource. And we can keep those lists, because our anger shows us like that's crossing the line with our values. And we want this to be better for our patients. And so our anger can actually lead to change, which can also lead to something called generativity. There's a psychiatrist and author by the name of Stephen Berglass, and he has a book called Kick Burnout in the Butt. I highly recommend the book. And he talks a lot about these stories where severe anger or sadness have led to people designing like amazing things, like the gentleman whose son was stolen in the store, and then he worked with local police officers, like how do you catch these people that are hurting kids and stealing. And so he made this huge company and a TV show and everything to try to catch the bad guys, and it worked. He actually changed the future of law enforcement because of his horrible situation. So sometimes something that makes us so horrible, so sad, we can then turn it into something that can help the next generations. And that's where you potentially could leave a legacy and say, like, I do have impact. I did make a difference. And that's really important to feel that. And the next thing here is something called MVP. And this is where we learn from other professions. And we do one thing, just try one new thing. This MVP stands for minimal viable product. is like make one thing and just see if indeed it can make a difference. And you don't have to be perfect at it. You just have to use a little bit of courage and try one new thing. Okay. So I'm going to stop sharing this crazy or get off the whiteboard because my writing is so messy. So that's okay. So hopefully you filled in the blanks. This is the, what we're after here is the 9 things I wish. And these are the 9 things. Now you see there's not a destination. It's not like you go 1 through 9 and you're done. But you could see that if you do learn how to brain prime, then you can avoid all the stressors and the exhaustion that can come with work, right? And if you learn how to align with your values, your strengths, and that power of belonging, you can have less confusion. You'll have more clarity, right? And if you learn how to design an interesting professional journey, you feel less stuck. You have a plan, and it's a really clear plan. Right? You got this, guys. Okay. So what step is your favorite? If you want to put it in the chat, I'd love to hear your favorites. Personally, myself, mine was the anger. I just couldn't believe that anger could lead to such change. And I think all the stories that's in that book called Kick Burnout in the Butt by Steve Berglass, he shares a lot of those. And there's some other books I'm glad to share about burnout and how to take that feeling like you can't make a difference and actually learn some steps to feel like you can make a difference. But again, these lily pads, they look like the shape of the brain on a lot of my MRI slices. So I just love these lily pads. Okay, so here's what we learned today. We learned how to make sense of the challenges of medicine. We have these 9 steps. We learned about some insight into the culture of medicine and the 3 levels of evaluating culture and figuring out the culture. We learned how important brain wonder can be and how it can help to guide us when we work in a high-risk profession. We learned that many of our colleagues are in a very high level of emotional distress, and that is contagious. So we have to be careful about the people that we spend time with, maybe out of work. Make sure you have that growth team that we talked about, because it's really important that we have people around us that support us, that are in positive emotions. You don't have to have everyone perfectly, giddy and happy around you, but people that are hopeful that there are ways that we can take steps forward. All we need is a sense of hope within our team. Not that we have all the answers, but that we know what steps to take toward finding more answers. We learned that there's a clear neuroscience framework that helped me very much and has helped my clients in Brain Fresh and in Brain Hammock, my latest program for women docs. And we learned that it's okay to learn from other professions. I built an Ocean 11 team of women from all different professions, and Allie Hively and I met with them regularly, and we shared a lot of the best practices that they had found to keep their professional journey really helpful and exciting, and so that was very helpful to us to learn from other professions. And there are solutions. There are purposeful solutions and clear solutions that we could take to help us find more meaning and purpose professionally. So of course, it's like a little pad. We're all floating in this pond of stuff, nutrients and a lot of stuff. And we learned about brain priming, aligning with our gifts and strengths, and then designing. So that's all you have to think about, right? Just start there. So what should you do next? You have a choice, right? We always have choices. You can take action or you can maintain the status quo. Maybe you feel like right now, like things are good. I love what's happening. I have a lot of opportunities. I don't need any support. Awesome. If you do, maybe think about those 9 steps and you can work on building your own unique brain support plan, your brain hammock. I love this picture because this person looks so peaceful, just looking at nature. And that's how I think of a hammock. I think if we know some things and we get some brain wonder and we figure out a few support measures, we really can then, work in our highest level as a woman doc, because, the world needs a lot of people working at their highest level, right? What we know about learning, though, is if we involve some emotions and skill building, we do better. So some of the studies that we're working with MBA students, Dr. Boyatzis, he's at Weatherhead at Case Western Reserve University in Cleveland, Ohio. I would highly recommend looking up some of his books. He has wonderful articles, manuscripts, and books. And he's a great speaker if you ever have a chance to hear him. But he also looked at the emotional intelligence. What does that mean? That means, why are we doing this? If we get to those 5 why questions we talked about, if you understand why you're doing it, what's important to you, if you feel empowered, you have positive emotions, you build skills faster. So knowing your emotional level, knowing what it takes to move you into a positive emotional state, you will build your skills more quickly. So what this showed in an MBA study is that if folks had both things, they knew something about emotions and they were trying to build skills, they were so much more able to sustain their improvements. So 40 to 75% improvements in sustained skill building as MBA students. So these are folks who are a little bit older, right? So they're in this age group, they were 45 to 55. So I know that age. I just passed that age. So, age doesn't matter, but that's what I'm saying. Let's be intentional about how we learn. And so that if we know, like, yes, we need some emotional intelligence and building our skills together, we will sustain the changes for longer. 40 to 75%. That was really huge. So how can I help? Well, I have a business called Brain Fresh. I have a YouTube channel, so feel free to look me up on Brain Fresh Neuroscience. You'll find me on YouTube and follow me. That I would love to see you there, and subscribe, please, because that helps people find me. It's just for women doctors now. I'm really focused on that. And I have a new program called Brain Hammock. And so who's the right fit for the program? It would be women docs who are just looking to build those professional skills so they can keep designing a really interesting professional journey. What's the value of it? Well, if you know exactly those 9 steps and how to keep using them throughout your career journey, you feel that clarity, right? You feel empowered, you feel supported, and less stuck and mad and, just trying to leave. Like, a lot of people want to leave because they don't see an opportunity in medicine, which may be fine. Please do what you need to do. But why do I do this? Well, I think the same reason I was a Girl Scout leader for 3 troops. This is a little picture of Girl Scouts. I believe in the power of women. I believe in women when they feel empowered, they serve their communities. So I want to do everything I can to support women at every level, and know and give them these foundational tools, because it's in the literature, it's in the science, and I'm glad to read the science. I actually like to read the journals and books and figure this out and bring it to you. So that's something I like to do. I sure wish I knew these things earlier as I was raising my 4 kids, trying to put, kids and life and work together. I wish I knew what were the must do's. I like to be efficient. I don't like to waste time. I wish I knew about that. So for attending the webinar today, you get the list, you get the link to Brain Hammock, you get the special coupon. This is just for webinar attendees. So feel free, that's a percentage off of the course. It's a monthly membership because we know, you can learn by a garden hose approach. Like, I could give you all the information, but really neuroscience of learning is you have to do a little bit over time and put it into action, right? So what are the next steps? If you were looking for support, some new strategies, and a community, that's what we have within Brain Hammock. So you can click on this link. I'm glad to send it to you. Click enroll, and then things will start coming to you in your email. I will also tell you, if you want to, you could download the app on your phone. And so it'll be on your phone. So you could listen to it while you're, exercising or what have you. There's video lessons, there's audio lessons, there's challenges, there's workshops, there's book reviews. I just tried to put a little bit each month, get some new opportunities to do a challenge as well so that we all learn together. So watch your email. I'll send this link and you can have it to think about it. We have this special coupon for the next week, so you can think about it for about a week and, use that coupon code SURPRISE. And thank you for your attendance. And I would love to hear from you guys. So feel free to send me emails at thebrainfresh at gmail.com and send your questions, your comments, something else you'd like to see in Brain Hammock. We're building it. And so it's pliable. So if you say, hey, I'd love to see this or that in there, I'm glad to think about it. I think, the most important thing are building these foundational tools. And when we do it together, we do it with a supportive team. It's more likely to happen. If we, like the research suggests, if we know something about the power of emotions and skill building, things happen. If we know also the neuroscience of learning, that we have to do it over time, that's why Brain Hammock is a monthly membership, so we can keep supporting your learning. You got this, guys. So proud of you. Thank you for attending. Thank you for listening to the webinar, and I'm so grateful for you and all the work that you do. It's really tough work, so please take care of yourself.